All right, Dr. Emer, we are live.
Hey guys, come on in and come take a look. We're doing our favorite laser today for acne scars and overall rejuvenation. Halo. You guys can see what this is doing. It's creating little dots on the skin, and these dots are gonna peel. She's gonna take your hand.
Yeah.
So that we can put an ice pack on the one side. So keep your hold right there. Perfect. There it is. It is free cooling. He has nerve blocks in, which is gonna make this more tolerable, but you still do feel it a little bit. I just try to limit it the best as possible. What we're doing is we are rolling across the area that we have scanned. He's pre-treated with a peel and a skin care to get his skin ready. You can see it's a little red, which is good. That's gonna actually means we're gonna get less risk of pigmentation and also more results because the skin is already pre-peeled. Make sure you guys are close so they can hear me.
I'm zoomed in. You have a mic on.
And, oh good, and you guys can see all the little dots. This is the erbium portion of the halo. And all those doctors out there, I'm not gonna give away my secret sauce of what this is, but I'll tell you, if you do enough halos, you can kind of see how big these holes are. And if you zoom in, take a look, they almost are like holes in his skin. See the little dots in the middle of each of those circles? That's literally a punch out of his skin.
All right, Dr. Emer, someone said, I want to microblade removal with you. I am scared of losing all my brow hair.
Oh, I know. Come see us. We can actually do plasma pen for that and get a really nice result. And we can do pico laser and be less likely to remove your brow. So definitely come see us.
Someone asking, how many times do we go over the same area? Maybe we're not going to tell them.
I can't tell you that, guys.
Guys, that's the secret sauce. We can't tell you.
That's the secret. But he's doing really well, given that guys are much more sensitive to lasers and have more pain typically. And you can see how strong this is.
All right, some people are saying that he's going to look great after this. They must be watching our results recently.
Well, we know that. We know it already that he's going to look great. He also has a lot of those like sort of ice pick scars, which we did TCA on. He has some rolling scars and sort of atrophic indented scars that we did Vellico on. And I think he's going to get a really good result. 1 or 2 treatments, he's really going to notice a big improvement. We're ready to do today the pro-fractional, which is our deeper erbium. And you guys know from all my posts how aggressive that can be, but what we can get as a result because of it.
Someone's asking, is this a one-time visit? And we have our Sciton rep saying happy Wednesday to you.
Hey, no, this is not one time. First off, scars take a lot of treatment. And also, rejuvenation is ongoing forever. So if you just want to stay looking young forever, we're going to keep doing treatments. If you want to keep improving his scars, we're going to keep improving with treatments. But he's doing really good. How are you? You okay? Good. You're more than halfway done on this side. You're doing great. So he was very nervous because we pre-treated him with a Fractura. And he had pain. But now he's doing better.
From our previous question, someone's asking how the plasma pen works.
Plasma pen? We're doing Halo, guys. This is not a plasma pen question session. If you have questions, tell them how to make a consult.
Guys, you get a consult with us. Send us a DM with your full name, email, and phone number, and we'll reach out to you.
And this is Halo. And the unique thing about Halo is that it has 2 different depths, 2 different lasers, each firing at the same time. So the little dots you see are the erbium. That's going to be on the surface, and that's going to peel. And he's going to see your really clear skin very quickly. Whereas the redness that you can't see is the deeper laser that's going to build collagen over time. Nisha's here. Nisha the PA is here. And she has a couple skincare products that she's going to recommend that we use. You want to talk about those a little bit?
Right. Hey guys, Nisha the PA over here at Dr. Emer's office, and there are a couple of key products that you want to use when you're using an ablative laser, or you're doing treatments here at the office, and I'll tell you about a few of the products that that we love here. Now, number one, let's start off with a good cleanser. Right now we're using the foaming polish. I recommend this cleanser because it's strong enough to remove any debris, but it's gentle enough that it's not going to strip your skin of any excess of oil. Moving on from this, I really recommend that in a ablative laser, you want to use your anti-age serum. This is the good stuff, guys. This is a concentration of growth factors of stem cells. This is really going to help you to heal after the process. It's one of the reasons why all of our patients heal so well after we do laser treatments on them. After that, we're going to tell you about another one of my favorite products, which is the Reset Face. You guys can purchase this here in office. We can mail it to you. This is a concentration of peptides. We know that peptides is the basic building block of almost all cells in our body. So this in combination with the anti-age is really going to expedite your healing process. So I'm going to include this in the skincare, but honestly, these two things should be a staple in your skincare routine, whether you're doing lasers on a normal basis, but really to take care of your skin. AOXC and Hyla B. AOXC is a strong antioxidant, and this is going to fight off any free radicals from the sun. This is the gold standard that you want in your skincare routine. Use it every day to help protect you from the sun. We also have Hyla B here, which is going to help to keep you moisturized. You can also use this twice a day, and it's really great to use after an ablative laser because you want to make sure your skin stays nice and hydrated, making sure that you're healing properly. Last but certainly not least, you really want to make sure you have sunscreen in your skincare routine. This is our Fusion Shield here, which is slightly tinted. This is going to work well after your laser treatment, well on a daily basis. We all know that you should be using skincare every single day, reapplying every 2 hours during the sun. And it's that combination of treatment after an ablative laser. Remember, when we're doing an ablative laser, we're doing controlled damage to the surface level of your skin. Okay? So
all right.
We're going to get back to you.
All right, Nisha has some fans here. Sliver said, I love Nisha. She can sell ice to an Eskimo.
So take a look, you guys. This right here is dead skin that came off the surface. This is also part of his scars. All that skin is now coming off with the halo. And we're going to go to the other side. If you guys want to make an appointment with Nisha, you can.
Nisha,
tell
tell them how to get a hold of Nisha the PA.
You guys can DM us, first name, last name, phone number, email address, and we'll be sure to reach out to you. And I would love to see you in office.
That's great. We love that. And then we're just going to continue treatment. What other questions they have for me or Nisha right now? Because this is going to take a little bit of a while, and then we're going to go to the pro fraction part.
All right, guys, ask your questions. We would love to hear it. We want to answer them for you. Doctors, we might not answer your questions.
We may or may not. It just depends. Don't try and take our special amounts. So he does have nerve blocks. He did topical. You can give pills. You can give nitrous. There's a lot of options in terms of pain reduction. The settings we're doing is more painful because it goes deeper and it causes a higher density of the erbium. What were they saying?
All right, we have someone asking, what are we doing?
Right.
Guys, this is our Halo. This is a hybrid fractional laser right now. We're going to do a skin rejuvenation and resurfacing for acne scars. We are going to do a profractional next, which is the fun one to watch. That's the one everyone loves.
That's the deep erbium, much stronger, and we combine it when we want to get much more of an outcome and people are willing to have the downtime. We've shown a lot of pictures recently of results doing these types of combinations. To really get a good result for scarring, you guys, you need to do combination treatment.
What are talking about you?
What are you saying?
All right, Saucy, can you do the neck also?
Of course, face, neck, chest, and hands. We're focused on his scars right now, so we don't need to do that. But yes, we could. He's also younger, and he doesn't need it yet. But we can do it in young people for prevention, of course.
They want to hear about our patient's pain level.
How are you on a 1 to 10 in pain?
5.
5. That's normal. 3 to 5 is normal without doing more nerve blocks. I'm trying to make it a little so he doesn't get too swollen, you guys. Now, you can give more pills and knock people out, or you can do more nerve blocks, but 3 to 5 is usually tolerable, and we get through it, and then they don't remember because the results are so good.
How long after filler do you have to wait to do this?
We did same day. What did we just do, Jordan?
Guys, we just did filler to his scars. We did Bellafill to help fill in his scars. That is our permanent PMA filler.
Yeah, and you can, I mean, again, this is going to a doctor with expertise. I've been doing this for many years, but I constantly go to meetings and people criticize me for doing it, but I've never had a problem. So here's an example of my patient right now that did that treatment. So we're gonna continue. We'll show you profractional. Unless there's any other questions, we'll show you that soon.
So is it when is it better to do this rather than a peel?
Well, he did a peel before. Tell them what they need to do to prep.
Guys, to prep for this, you need to do a Cosmelon or Enlighten peel. Let me have Nisha tell you a little bit about that.
So we have to prep for our aggressive lasers with a Cosmelon or Enlighten peel. Each one is a little bit different. Enlighten peel, you peel anywhere between 7 to 10 days. Of course, you have to take care of that accompany this. And then with our Cosmelon peel, you peel anywhere between 10 to 14 days. Which peel is really going to be dependent on what we're trying to achieve. If you guys want any specific questions on this, which Cosmelon or Enlighten peel is better for you, make sure you get a visit with our office and be able to tell you more specific details.
All right.
And that helps reduce pigmentation and allows us to get a stronger result, which is why he was a little red when he came in today. Prepped him for our laser.
They want to know if they get a nerve block list. Yes, guys, we do nerve blocks for this one.
He did it, and even with the nerve blocks, he still feels a little bit, you guys. He's gonna feel it a little no matter what.
All right. Some people are asking, what is the name of the permanent filler? Guys, that is Bellafill. That is our PMA permanent filler. We use it for acne scar, and we use it for all areas.
Search it on YouTube. All right, well, I'm really excited, you guys, for you to see the rest. We'll show you him in a little bit when we start the profractional. Bye.